This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
If you've been watching this show for any amount of time, you've probably figured out by now that there is a day, a week, a month for just about anything. And some holidays, if you will, are silly, but others are quite serious and shed light on many important topics.
So we're focusing on one of the important topics today, as it's the start of Wound Care Awareness Week. And here with more are the medical director of PRMC's Peninsula Wound and Hyperbaric Center, that's Dr. James Burns right over there, and the center's program director, this is Beth Reed. Thank you so much for joining us today.
Hello, thanks for having us.
Okay, so Wound Care Awareness Week, what is that? Give us an overview.
So Wound Care Awareness Week was created in 2014, and it was to bring awareness to the 6.7 million Americans who are living with a chronic wound every single day. Program directors across our great nation are dedicating 100% of our time this week to educating not only physicians, but the patients and also the community and the public at large on this growing epidemic of chronic wounds.
Yeah, okay, so Dr. Burns, what would you classify as a chronic wound?
A chronic wound, well, we all cut ourselves. We all fall, we cut, we scrape ourselves and so forth. And the body has a tremendous capacity to heal itself, and normally it follows a nice orderly set of stages, and within a month everything's healed. There is a subset of the population with certain medical diseases and other chronic conditions where it extends beyond that 4 weeks. So anything beyond 4 weeks, we consider a chronic wound.
So it's important to highlight this medical issue.
Well, absolutely. The reason is, in wound centers, as most people don't know, the majority of the types of wounds that we see come from two classes of people, those diabetics and chronic venous disease of the lower extremities. Just as an example of the magnitude of this problem, there's probably 30.3 million diabetics in the United States and growing. They figure there's an estimate of 15% of those will develop what they call a diabetic foot wound, which is by definition a chronic wound. That's 4.5 million people. Now add to that the chronic venous disease. There's an estimate of 25 to 30 million people with chronic venous disease. 10% of those have an active open ulcer on their lower extremities. So add those two together, that's 7.5 million people actively with chronic open wounds. Now, to make that even more important, if you're going to later hear that Healogics, for whom we work, and manages 700 centers in the United States just for wound care. So if you divided up those 7.5 million people, that would be 10,700 people per wound center active right now.
And just to recap, chronic wounds, they just don't heal, right? They don't heal.
There's a reason for that.
And there is a reason for that. But if they don't, and if you don't get it treated, it can turn into a more serious problem?
Oh, absolutely, yeah. And the biggest problem that we find is the quality of these individuals' lives. They sequester themselves. It's a burden on them, their family. It changes the activities of their life tremendously. Not to mention the chronic problems that they can face, such as infections that lead to more surgical problems, surgical issues, and even amputation, which we see quite frequently.
Wow, it goes that far?
Yes.
How about that? Okay, so you mentioned Healogic. You're one of more than 700 centers managed by Healogic.
Yes.
Explain to that, what does that mean?
So Healogics is based out of Jacksonville, Florida, and they are the nation's leading wound treatment providers. So they are solely focused on just evidence-based practice and advanced wound therapies, such as hyperbaric oxygen therapy we might use, or cellular-based products for skin grafting, and that's just their focus, just to really focus on this epidemic and bring this underserved population to the forefront.
So you mentioned, Dr. Burns, about, certain, we all get wounds and we get cuts. When do you know that you need to get help? It's a chronic wound.
If you've got something that you have been taking care of well, okay, and it has not closed up in 4 weeks, give us a call.
Yeah.
Absolutely.
And treatment can really turn a patient's life around.
Yeah, many times you just don't know what to do, and our job is basically to find out why this is not healing and reverse that process.
And apparently you do that quite well.
We hope so.
All right.
We change patients' lives.
Yeah, that's wonderful. Beth Reed, Dr. Burns, thank you so much.
Thank you so much
for coming in and talking about wound care.
Thank you.